Next we have got Guisti-Heighton method, which assumes that the effect of reduced kidney function on the renal portion of elimination constant can be estimated from the ratio of uremic creatinine clearance to the normal creatinine clearance. So we can write it in this manner, where this is the uremic renal excretion rate constant and this is the normal renal excretion rate constant, which is equals to, this one is the uremic creatinine clearance and this one is the normal creatinine clearance. Okay, so let it be equation number 1, and you can rewrite it in this manner, that is the uremic renal excretion rate constant is equals to the normal renal excretion rate constant multiplied by the uremic creatinine clearance divided by the normal creatinine clearance, and let it be equation number 2. Because the overall uremic elimination rate constant Ku, it is a sum of renal and non-renal elimination rate constant. So you can write Ku equals to Knu, that is the non-renal elimination rate constant in uremic patient plus the renal elimination rate constant in uremic patient. And over here, in place of this, you should write this equation number 2. So you can rewrite in this manner, Ku, that is elimination rate constant in uremic patient equals to non-renal elimination rate constant in uremic patient plus this value. So this be equation number 3. Now in continuation with equation number 3, dividing this equation 3 by Kn, you can write it in this manner. Let it be equation number 4. Now let Fe equals to Krn divided by Kn equals to fraction of drug excreted unchanged in urine, and 1 minus Fe equals to Kunr divided by Kn, that is fraction of drug excreted by non-renal routes. Okay, Fe means fraction of drug excreted unchanged in the urine, and 1 minus Fe is fraction of drug excreted by the non-renal route. So Fe is written in place of Knr divided by Kn. So over here, in place of this we should write Fe, and in place of Kunr divided by Kn, that is this one, in place of this we should write 1 minus Fe. So you can write it in this manner. Substituting equation 4 yields the Guisti-Heighton equation, where G is the Guisti-Heighton factor, which can be calculated from Fe and the ratio of uremic to normal clearance. Okay, in this manner, or you can rewrite it in this manner also, and let it be equation number 5. So this Guisti-Heighton equation is most useful for most of the drug for which the fraction of drug excreted unchanged by the renal route has been reported in the literature. The ratio of Ku divided by Kn can be calculated from the fraction of drug excreted by the kidney from the normal creatinine clearance and the creatinine clearance in the uremic patients. Next we'll have a practice problem. The maintenance dose of gentamicin is 80 mg 6 hours for a patient with normal renal function. Calculate the maintenance dose for a uremic patient with creatinine clearance of 20 ml per minute. Assume a normal creatinine clearance of 100 ml per minute. So solution is, first of all, what drug it is? The drug is gentamicin. So check out over here, gentamicin. This is the Fe. This is the half-life. I'll zoom it so you can see over here. This is the Fe. This is the half-life. Okay. So we can use this thing Fe. The value of Fe is 0.98, which is almost equals to 1. So using the equation, Ku divided by Kn equals to 1 minus Fe into 1 minus creatinine clearance in uremic patient divided by creatinine clearance in normal individual. So add the value. Fe is 1, and in this problem only you can see the creatinine clearance is 20 ml per minute, and assume the normal creatinine clearance to be 100 ml per minute. So we add all these things and we got the value of 0.2. Next, you use this thing du by dn, that is dose in uremic patient divided by dose in normal individual is equals to the elimination rate constant in uremic patient divided by elimination rate constant in a normal individual. So add the value dn, the dose in normal individual is 80 and the value of ku by kn we got 0.2, so 16 mg. The maintenance dose is 16 mg for every 6 hours. Next, alternatively, the dosing interval can be adjusted without changing the dose. Okay, so we are keeping the dose same. We are using a normal dose. The normal dose is 80 mg and the normal dosage interval is 6 hours. But we can increase the dosage interval by using the formula tau u by tau n equals to kn divided by ku. So you can see over here, do not get confused. This is ku by kn and this is this one is kn by ku, this one is kn by ku and this is ku by kn. So you simplify it, tau u equals to tau n multiplied by kn divided by ku. So what is the normal dosage interval? That is 6 into 1 divided by 0.2, and calculating we got the time 30 hours. So you can say the patient may be given 80 mg every 30 hours. Next, we have got another practice problem. An adult male 52 years old and 75 kg whose serum creatinine is 2.4 mg per deciliter is to be given gentamicin sulfate for a confirmed gram-negative infection. The usual dose of gentamicin in adult patients with normal renal function is 1 mg per kg every 8 hours by multiple IV bolus injection. Gentamicin sulfate is available in 2 ml vials containing 40 mg of gentamicin sulfate per milliliter. Calculate A. The creatinine clearance in this patient by the Cockcroft-Gault equation method, and B. The appropriate dosage regimen of gentamicin sulfate for this patient in mg and ml. Now this is a very big so many words. So we'll simplify this thing. So suppose this is an adult male patient. What all values, what all data is given is age is 52 years old, weight is 75 kg, and it have serum creatinine level of 2.5 mg per deciliter.